Hello everyone. Today I'll be presenting about the types of artificial ventilation and how the types of settings that are available in hospitals for ventilating a patient mechanically. Artificial ventilation is a mean of assisting or stimulating respiration, a metabolic process referring to the overall exchange of gases in the body by pulmonary ventilation, external respiration and internal respiration. There are three types of artificial ventilation: manual, mechanical, and neurostimulatory. Example for manual ventilation is mouth-to-mouth resuscitation. Mechanical ventilation it can either be done using a ventilator or can be done using an ambu bag. A neurostimulatory ventilation is done by keeping a percutaneous electrode to stimulate the diaphragm or the phrenic nerve, which causes movement of the diaphragm resulting in respiration. Mechanical ventilations can be positive pressure ventilation or negative pressure ventilation. Positive pressure ventilation involves forcing the air through the airway in order to expand the lungs. So here we see on the left we see a ventilator mechanism which forces air in. On the right we see an ambu bag which is used in case of emergencies. This is a normal setup of an ambu bag with a mask, pressure release valve, a self-inflating bag and a reserve bag and the oxygen tubing. This tubing is attached to an oxygen source through which the oxygen is delivered to the self-inflating bag. The operator will apply pressure on this bag in order to deliver oxygen to the patient. This is a negative pressure ventilator. So in this setup, simply inside the ventilator there is negative suction where the air is moved out. As a result, there will be a decrease in pressure. However, inside the thorax, intrathoracic pressure, it remains same. Because of the decreased pressure, there will be relative increase in intrathoracic pressure. As a result, the lung will expand. This is a normal setting of mechanical ventilators, especially positive pressure ventilation. So there are two types of settings: volume control setting and pressure control setting. In volume control setting, the operator will set a specific tidal volume, and this tidal volume it's also known as target volume. This target volume is maintained throughout the phase of respiration. However, in order to achieve this, the ventilator will change the pressure. So as you can see in here, the volume is same, however the pressure it's changing in order to achieve the particular volume. Also we can see that sometimes the patient may show their own efforts in order to inspire. In that case, the mechanical ventilatory pressure will reduce and allows the patient to take the breath in. However, the volume will be same. Pressure control, the pressure of the ventilator will remain same. However, the tidal volume, it may vary. This is done specially in case of acute respiratory distress syndrome. This is in order to avoid alveolar damage or damage to the lungs, because the lung is already non-compliant. So if we increase above the set pressure, it could damage the lungs. So this is a typical setting screen of volume sensitive intermittent mechanical ventilation. So here we have already set a tidal volume of 420 milliliter and a peak flow rate of 60 milliliters per minute, respiratory rate of 15 breaths per minute, positive end pressure, that is the pressure inside the lungs after a complete expiration. Positive end pressure here we have set as 5 centimeter water. In normal person, it's from 3 to 5. Since usually patients who are under trauma need ventilation, we set it at 5 centimeter water. FiO2 is the saturation of oxygen which we deliver in, which is usually it's set to 100%, and then gradually it's reduced to 60% when the patient is stabilizing. Trigger sensitivity can be set when the patient is starting to stabilize and is attempting to take their own breath. We can set a volume of 5 liters trigger sensitivity, which means when the patient inspires 5 liters of air, the machine will stop supporting the patient and aid self respiration. Pressure sensitive intermittent mechanical ventilation. Here you can see, unlike in volume stimulated, here we set tidal volume. Here we must set peak inspiratory pressure, which is around 22 centimeter water. Peak flow respiratory rate and positive end pressure, they remain at the same. FiO2 also initially set at 100%, and then we can gradually reduce it to 60%. Trigger sensitivity we can set when the patient is able to take normal PIP. In that case, we can let the machine to stop giving efforts. This is in stimulated mode. Thank you.